Good morning, everyone. Thank you for being here. And I'm glad we had this opportunity to have this presentation. So my name is Alicia. I'm one of the co-chairs, and we have Maya here, my co-chair too, for the Conference Planning Committee. And then we have Mary that's helping us continue this. A lot of guidance we're getting. But it's been fun. So this is a professional abstract submission discussion with a Q&A. So I'm going to go over submit an abstract, general information. And please feel free to type your questions in the chat, but do hold your questions to the end. We do have a Q&A session, frequently asked questions. So whenever if you do forget, if you have a question and you're like, oh, I need to ask it, just type in the chat, and then we'll reach every question, and then of course open it to everybody to place their questions. So so again, mark your calendars for March the 10th to the 13th. That's a Monday, at the beginning of the week, and we have our I don't know what annual this one is, but it's 25th annual conference in Boston. I'm so excited to go to Boston. Let me get there early to enjoy the city. Okay, so without any further ado, we can go to the next slide and start the presentation. Okay, so as you see here, proposal space, my name's here that I started a proposal submitting an abstract. So the call was for professional abstracts, whether it's pharmacology or non-pharmacology. And I started my stop, started here. Next slide. And so the topics here we categorize them into three. As you see, sphere impact, the direct care sphere impact, nursing practice, organizational system sphere impact, and then across the spheres of impact abstracts that showcase the following given preference. That's something that we always want to showcase. So, and we put that also to kind of help you think whenever you're submitting abstract, we do some financial. It may be small and then you or may not think, but I think if you put that financial on there, we want everybody to know how the CNS is involved in the healthcare system. And then directions for the abstract submitter. So the reason we put these different spheres of impact is to help us, a conference planning committee, place them into buckets. And when we are doing the whole presentation, as we start on day one to the end of the conference, we're able to put them all together. And later on, I'll show you more categories that we're dividing as we move through the proposal space. And if you feel that there's more different types of things under like direct care or nursing practice, organizational system that we didn't listed because they're called differently in different parts of the country, feel free to provide them for us. So as we move on to the next year, we can also incorporate those. Next slide, please. Okay, so now I started my proposal, my abstract submission. And so I put my test abstract because I'm just doing a test, going through the motions. But you would put your title, your abstract, and then limit the words here, the word count. And it's just to help us guide, it's not to do anything else, but the learning objectives. So as you see, there's 3 learning objectives. And then, of course, I put assess, examine, identify. Those are probably not considered the text, Bloom's taxonomy, this learning objectives, but there's just so I can move along with the proposal space and present this presentation. So you look at your learning objectives and list them here one by one. Next slide, please. So now we go to types of presentations. So you see on the types of presentations, you have pharmacology lecture, podium presentation, symposium, clinical management lecture, workshops, and poster. And as we have here, I put podium, and then I'm going to pick what population. Again, we thought of all the populations that CNS is influencing or impact caring for, and again, that is to help us align those presentations. So if we have all neonates, we can put them on in a place on the first day or second day of the conference, and that way everybody that's neonates knows, oh, we go there. Again, it's all for aligning the conference and having people see their um, population that they work with. And then the setting again, it's to help us, categorize them into the info bucket, and then we do the large conference plan in our venue. Okay, so next slide, please. And then, so for the purpose of this presentation, I picked symposium. And as you see here, we have types of presentations, podium, at symposium, clinical management, pharmacology, workshop, and poster. And that gives a little bit of information on what we're calling that. Again, if you feel like this was not complete, please let us know. This was, with the conference planning committee, we went over this thinking that, we have different people, conference planning committee from different parts of the country. So we thought it was a good description. Again, if you have other ideas or you see it from a different view, we're welcome. As we can move on to the next conference, we can adjust that. So I picked for this one a symposium, and it says it's that the symposium abstracts are submitted as a collection of 3 abstracts. So each individual abstract must have an individual abstract title, but they use the same symposium title. And that's to, to put the symposium there, and then we have the 3 listings of the abstracts. But then sometimes we see an abstract very stands out that's really, and we may have to change it and not have a symposium, but that's we don't want to deter anybody, and we really want to make everybody come into the to see showcase their work. Next slide, please. And then so then I hit here some again talking about symposium title, and then I clicked on here. The abstracts are submitted as a collection of 3 abstracts. Each individual abstract submission must have an individual title, but use the same symposium title. And again, if you feel like that statement is wordy and not clear, at least when we get to the Q&A, we can talk about that. Next slide, please. So in this section where you're determining, again, this is also determining the specific topic of the submission among the 3 spheres of impact. And then for each sphere, there's a drop-down box. So whenever this again is to categorize and see where we're going to go, either the direct care, nursing practice, organizational systems, or other. And again, if you hit other, it'll pop up a box and you would type in there. I think there was a glitch on there at one point, but then it got fixed because you would sometimes go to it and then it went okay. So if you so in this one here, I put direct care, and you see how it populated all these other ones here, dropped on that I had to click one of these, at least one required. Again, if you feel like there's something else under direct care sphere, let us know. Next slide. So this one here, this is for purpose of explaining in this presentation, I went back and unclick direct care and then click nursing practice so I can see what is under there. So these are all pertaining to that, but it's the same abstract, like I'm going back, what's under nursing practice. And then the next slide, it'll show organization systems. Oh, what's under that? And so then I would click. And then if I hit other, I think the next slide, I would have to type in what it would be on there. And next slide. So now this part here, this is so whenever if you hit nursing practice, this applies to any abstract you put in. As you see, the last 4 slides were like I was just explaining you the abstract itself, but when you hit gap, that's for everybody. Everybody, whether you're doing nursing practice, direct care, or systems, you would have to like gap in knowledge, gap in skill, or gap in practice, at least one. And then pharmacology content. if it is, none if it's not. And again, this helps us if you have pediatrics, and you don't have any pharmacology, okay. But if there's like 5 submissions, so 5 abstracts that do have pharmacology, then we want to put them together. We want to say, okay, the non-pharmacology can go at the beginning or the end, and vice versa. And that way, people that are in pharmacology in pediatrics that need farm hours, then they would say, oh, this is the same, this, I want to go to this because I need my farm hours. Next slide, please. And again, for the background and significance to advanced practice nursing, that applies to everyone here. You would be putting on what the significance to advanced practice. And if you click on the little question mark here, the orange, the pop-up window here, as you see in the blue arrow, and that's just a guidance for writing the background and significance to advanced practice. Your abstract can be a research or it can be a quality improvement project. So this is where we try to, for clarity, that people would help them say, oh, okay, if it's a research, identify it. And they're like, no, mine's not a research, it's just a project. So then all other abstracts would be identify the problem, and then why is it important to advance practice nursing, yeah, and then clinical practice. And so that's all helpful things that, again, we brought this together as a conference planning committee that would help everyone that's wanting to submit an abstract. Next slide, please. And then purpose. Again, you describe your purpose of intent of your project. What did you want to achieve? What is the research question or aim? Question or hypothesis? And then I'm going to let Maya, so anything you want to add to this one? I think you've also given me best to describe this part and the purpose objective.
No, I think the only thing is I know that the verbiage says project, but I also understand that some of our abstracts might not be project centered or related. You can have presentations that have nothing to do with a specific project, but with some new information or whatever other theme or topic. So just don't get deterred by the fact that it says intent of the project. If you're doing a presentation that is not project related, then you'll just write the intent or the purpose and the background and whatever else the method of your presentation, of how you were to be presenting it or what would you be presenting, and kind of making the point of why this presentation is important or needed or providing new information.
Yeah, thank you. Next slide, please. And so again, like you said, methods and process. What methods you're going to be used, or what methods were used to develop or implement the project. So again, this is don't deter from this and saying, it's not a research or it's a project or a presentation that I'm doing. Next slide, please. And the evaluation. And I think I'm going to let you, Maya, again, because I think you've worded it really well to me, explaining further evaluations.
I mean, this will be also in the Q&A section, but some of the questions that came through were, if I'm doing a workshop, what should I be putting in my evaluation or outcomes? Or again, if I'm doing a presentation that is not related to specific project or not describing a specific project that would have outcomes, an evaluation process, what am I supposed to put in here? And really, basically, if you're doing a workshop, then you have learning objectives that you're identifying for the participant to come out with as part of your workshop. So your evaluation and your outcomes should focus on what would be these learning objectives, how would you evaluate them, or what type of an outcome would it be for a participant that's coming to your workshop? What are they coming out with? So the way I see it, if you're submitting for a workshop, you go back to your learning objectives and build your evaluation and your outcome out of that. You're not going to have your numbers because you have to administer the workshop first before you can see your outcomes, but you can describe what would be the data or the outcomes that you will be potentially collecting throughout your workshop to show here, these were my learning objectives, and here is how I achieved them basically by the end of the workshop. So that's kind of the guidance we've been giving other people who were interested to submit abstracts. And the same would be for presentation. Again, if it's not a project, clearly you're not going to have outcomes to be presenting in this section. So for presentation, it would be the same idea. You have learning objectives for any type of presentation. So from those learning objectives, how can you evaluate that you actually achieved them?
Thank you so much. Okay, next slide. And then again, for discussions and implications, and describe, from your project implications to the nursing, to the CNS and or nursing practice. And if it's a research abstract, we put that on there, you're coming from a research perspective. You would put the implications, and I think Maya explained in the last similar, go in that thought process to input the information here. Next slide. And then again, these are just basic, so we can kind of say, oh, early career, mid-career, senior career, good for all levels, and to see where where we stand as an organization, the NACNS organization, and what we're reaching. And then describe, does your presentation have any limitations? Again, this is again for the virtual and people helping us, for a conference. And then if you were to promote the presentation on social media, colleagues, how would you describe 1 or 2 sentences? And again, it's all to advance our all our work that we've done and just disseminated even more beyond the national conference that we have every year.
Just to go back to the presentation limitation, the idea here, and limitation might not be the best word, but the idea is just for us as the planning committee to be prepared. If your presentation potentially cannot hold more than 20 people or 30 people or whatever, for if it's a workshop that will require you smaller groups, or if it's some type of a symposium or whatever it is, that you feel that if you were to have a smaller group of participants versus large group of participants, you would kind of include it in here so that we know to prepare for that, so we can limit the number of people who will be attending that specific talk and prepare for that in advance. Or if you're going to have some special AV needs beyond the normal, projector with a screen for your slide deck and all of that, just for us to be able to work on it in advance and be ready for your presentation. So that's kind of what you want to think about when it comes to that. This is an optional question. So if you feel like whoever comes and however many people come, that's fine, then you don't need to put anything there.
Thank you. All right. Next slide. And then again, just uploading your supporting materials here, uploading your reference list here when these formats are allowed. You add a primary presenter here. And then please let us know who your co-authors are. And as you just note here, please note podium presentation abstract with multiple. We ask only 2 speakers are selected to present. Next slide. And then we get to the
going back to the other slide, I'm sorry. I just want to
Yes.
make sure that to stress the fact that the supporting materials is optional at this point. I know I had a couple of people who thought that they had to have their slide decks already ready to submit here with their abstract. That's not a requirement. If you have handouts that are ready to go, or things that you think can support your abstract, and you wanted to share it in advance, you can, but don't feel obligated to have your handouts or your slide deck or whatever else ready to go at this point of the abstract submission.
Thank you for clarifying that. Okay, now we get a Q.
Okay, so these are just a couple of slides with some summary of questions we have been receiving so far since the abstract call was started. And so we kind of summarize them here, and after we're done with that section, we will open the stage for all other questions in addition. So this question might be already irrelevant, but what happened originally while the call for abstract came out was that no matter what sphere of impact you would choose, if it was nursing or direct patient care, the organizational systems sphere kept dropping down as well with the topics, which required you to pick a topic in that specific sphere, even though you wanted to use the nursing or the direct patient care sphere. So at this time, it is corrected. And as there's no further, if you already submitted an abstract while this was happening, that's fine. You don't need to change anything or do anything. If you are in the process of submitting the abstract and it happens to be that you still encounter this issue, you can just pick a random topic from that sphere, because basically we know that that's the only sphere that kept dropping down in addition to whatever other sphere you picked. So when we go back and we assign reviewers to the abstracts and we assign the abstracts that were picked for presentations and such, we will know that if an abstract has two different basically spheres for topics, we will know that that's the one that has the organizational is not what you actually were picking. So from that perspective, nothing to worry about if you already submitted your abstract. And again, if you're doing it now and it's still happening, just pick a random topic in that sphere and make sure to pick the right topic for your actual sphere that you wanted to submit your abstract for. Next slide, please. So we do have word counts that are mentioned in every section of your abstract submission, starting with the title, including through the learning objectives, and then through the different sections of your abstract. The word count really that is provided is telling you what is the maximum word count to be used. So if you don't reach that maximum word count, that is okay. You're not required to have that exact number to submit your abstract. We will say though, let's say if you just write one sentence in each section, like for background and purpose and outcomes and evaluation, that doesn't give us a good understanding of your presentation and your abstract, then of course that we want you to kind of put a little bit more words and ways to explain what you're trying to basically present, but you don't have to reach that specific maximum number of that is mentioned for the word count. Now, we do encourage any NACNS task forces and committees to come and present the work they've been doing during the conference. And we do ask that abstracts will be submitted for that purpose. Now, in the past, if an NACN task force or committee submitted abstract, they were able to put in the full name of the committee or task force in their abstract, and that is fine. There's no issue with that. Next slide, please. Okay, so we do have symposiums, and symposiums are basically a collection of 3 different abstracts together into one presentation. One question that we received was, what happens if my symposium abstract doesn't get accepted as a symposium? Would we be considering the 3 abstracts as a standalone presentation, or can we consider each one of the abstracts as a standalone presentation? And the answer is yes. So if the symposium is not accepted as a symposium, then those 3 different abstracts can be considered as a standalone podium presentation. Next slide, please. And this we kind of already alluded to earlier. So how do I write an evaluation and outcomes if submitting for a workshop or a presentation that is not project-based? Again, clearly you're not necessarily going to have specific outcomes or evaluation to include already in your abstract. So you would use your learning objectives that you identified for that presentation to guide you in the process of writing up your evaluation and outcomes. And I believe that's the last slide. Yes, okay. So we will open the stage for questions. It looks like there's some questions already in the chat. Okay, so the first question I see here, it might be actually for Alyssa and Kimberly for the CE process, if I'm not mistaken. For our state contact hours, pharmacology include pharmacotherapeutics, so diagnostics and all other pieces and parts related to pharmacology. Does this include that expanded scope as well, or content related to specifically medications only included for pharmacology for CE purposes?
I can't answer that question as best as you want me to. The only indication of pharmacology sessions that would not be eligible are those that mention ketamine or cannabis. So however you choose to submit your pharmacology abstract, the review process will determine if it has enough pharmacology content to be considered for presentation at the conference. Otherwise, a Medco, who is our accreditor, those are the only prohibits.
If I could go ahead and chime in as well, as CNSs for pharmacology, you really want to go ahead and start out with what is the pharmacokinetics of the medication, how is it used. It is helpful in conferences to go ahead and talk about what are evidence-based dosing. And if you could go ahead and section that out, if you have dosing that may be a little different in different areas, that would help too. The goal is to go ahead and help inform all CNSs of what medications are available, how are they used in a general population, and if it's a specific population you're focusing on, we understand that. But the goal is to go ahead and give as much information on these types of medications so we have an informed decision on how we go ahead and prescribe the medications that you're presenting.
Okay, and I see the second question was already answered, the question about whether or not this recording will be available at a later time, and it will be on the NACNS website. Okay, so our abstract is still ongoing, but will be completed in the next 2 months. Can we still submit? Also, because of that, our PowerPoint and report won't be ready for the submission. However, we have a fairly robust description in the required boxes. I'm assuming what you're missing is basically your outcomes for your project, which is fine, because if you're going to have outcomes, specific outcomes by the time of the conference, then when you're submitting the abstract, what you can do is describe what will be your form of evaluation. How are you evaluating your specific project or your specific outcomes? So as long as you have that process in place and what outcomes you will have available by the time of your presentation, then you could just include that in your abstract. And I don't know, Mary and Alicia, if you wanted to add something.
Yes, I agree with their statement that by the time that you would be presenting, I think you don't have to submit your PowerPoint now. So just as you describe how your outcomes will be completed.
Yeah, and I would just go ahead and add, I agree. And I think the biggest thing here is because we know that there are going to be projects that are still ongoing. If you're really looking at what are your proposed outcomes that you're looking at, and if you want to go ahead and add in that you're looking at the differences or an increase, or if you're looking to go ahead and support what you are proposing as part of your project, that's actually what you would want to go ahead and describe in that section.
You also can feel free to unmute yourselves and just ask your question as well if you don't want to put it in the chat.
Yes, please.
Hi. I'll be a first time, attended last year and I'll be a first time submitter of an abstract. What's the process after, if we do get accepted?
So you mean like what would be the next kind of milestones throughout until the presentation?
Yeah, like we're working on our PowerPoint and stuff right now. I was the one that wrote the still ongoing abstract. But I noticed when I was at the conference, everyone used, I think, or the National CNS PowerPoint. So like, will we get like
Mm-hmm.
assistance or like on how to make sure we do it all the right way? And
Yeah,
then if
you
we
will.
want to
Go
print
ahead.
something to hand out, is that okay?
Yes. So basically, if your abstracts get accepted, when you get that notification of acceptance, you will receive all the detailed instructions on what are the next steps. When it comes to the template of the actual conference, that will be provided to you as well in that acceptance email. I believe last year we did recordings of presentations in advance for the virtual upload of them. And if I'm not mistaken, this will be the process this year as well. So you'll have all the information on how to do that, how to sign up for your time for recording if you wanted to do it during the time of the conference instead of submitting it in advance. So all of that will be provided, and we will continue supporting everyone and anyone through the process until the actual time of presentation. So it will still be available for questions and for any type of clarifications through the same type of email, basically, like we had so far.
And there's a question on the chat. You mentioned the NACNS committees could submit abstract include their name. And what I think what we mean name is the name of the committee, correct, Maya? Is there
Yes,
any
that was one of the questions was
Mhm.
if they should include the name of the committee. So the name, yes, of the committee.
And is there any priority for these groups highlighting their committee work? They're going to the same abstract. There's not any separate committee. The abstract still gets reviewed by the same, committee. Then maybe Mary, you could speak to that too.
Yes, so for when any NACNS committee submits, it still would be going through the same process. You'd still be writing what is the title, and you'll still be going through objectives and talking about the outcomes of the committee evaluation and what you want people to know about the committee. So really, it's not going to be talking about just the committee. You want to go ahead and highlight what the committee has been doing, how is it supporting CNS practice, and how people that are attending this presentation, what do you want them to go ahead and know and be a part of, and then also to the outcomes, because every committee has a charge, and that would be good to go ahead and place in there as you're placing your abstract. What is the charge that NACNS is having for your committee, and how are you meeting that, and how are you going forward in your committee work, and how does that support CNS practice?
And to just add to Alicia's comment about that it's going through the same abstract, I think what you meant, so basically we have a peer review process, right? So after you submit the abstracts, we have volunteer reviewers who are provided with a standardized rubric to review each one of the abstracts, and in which each abstract will be reviewed by at least 2 reviewers, 2 independent reviews. And basically, according to the scoring that each abstract receives, that's basically what determines acceptance. So that will all the abstracts will go through the same process.
And then I think another question was abstract. If you abstract submitted, when will you receive a notification? I don't have that time off the top of my head, but I think we do have a deadline, right? I mean, we have it already in our Kimberly or Alyssa. Do we have when we're gonna?
What is the exact question?
When is your when your abstract is accepted? When will we receive notifications? Like when are
Um,
we? Mhm.
Well, I
Just,
suppose that always flexes, but the goal date to send out those communications, based on the review process, is early December.
Thank
Okay,
you.
thank you.
Before the holidays is the goal, so
Yes, that's true. That's
everyone
a
can
point to
focus
make.
on those.
Yeah, that's a point to make. Before we try to get away from the holidays, whether you're a reviewer, whatever you're doing, that way you can enjoy the holidays and get back into business after the new year. Any other questions?
I think there might be something on the chat. 1 second. Oh, thank you. Thank you, guys.
Yeah, thank you. All right.
I think it's safe to say, if any questions still continue, the planning committee is always here to go ahead and answer questions. This Q&A is not going to be the last, because questions may occur, and we really want to make sure that everybody is supported. They have even little questions that come up as you're submitting your abstracts. We want to encourage and support all of our CNS colleagues to go ahead and place information projects or any symposium or workshops so that we can go ahead and advance our CNS practice.
Thank you, Mary. Questions or thoughts?
I think so.
Thank you everyone for joining. The recording will be posted on our website.
Okay. All right.
Oh.
Thank you.
Thank you.
Have a great day. Bye.
All right. Have a great day. All right. Bye, everybody.